Okay, well, over the next few lectures, we get to talk about some really important parts of the eye, and that's our blood supply of the retina. If we don't have proper blood supply, we can't see. We will also talk about the ciliary body, which is really critical when we talk about glaucoma, a potentially blinding condition. And we'll talk about the iris, and that's the colored part of the eye that we look at every day, and it regulates the light so that we will be able to see properly. Together, all of the areas that we're going to talk about today are called the uvea. The uvea is the middle layers of the eye, and it's composed of three regions, and we'll draw those out. If we cut the eye in half, so we are looking at it from the side, the first part of our uvea is the iris. And that's the colored part of the eye. So we'll draw it blue. You can draw it brown if you would like to. That's our iris. The second part of the uvea is the ciliary body. The ciliary body is behind the iris, and it's what produces the aqueous, and it controls accommodation. So our ciliary body is in this area, keeping in mind that this is a 3D structure, so it does go all the way around the eye. The final area of the uvea is our choroid, and that's what supplies our blood to the retina. So it starts at where the ciliary body ends and goes all the way around the posterior portion of the eye. So over the next few lectures, we will talk about those three areas. We're going to start today with the iris. The iris is anterior to the lens. So if we add our lens into our drawing, the lens would be in this area here. And you can see that the iris is anterior to the lens, and it's posterior to the cornea. It's a circular structure, and the average diameter is approximately 12 millimeters. There are some important landmarks that we need to know about the iris. The first one we're going to talk about is the collarette. The collarette is a ridge, and it is about 1.5 millimeters from the pupillary margin. Now, if we look at the eye straight on, like you're looking straight at me, here is the edge of our iris, and here is our pupil. The collarette is about 1.5 millimeters away from the pupil. And what it does is it divides the iris into two regions. One of the regions is the pupillary zone. And as you can guess, that's the zone closest to the pupil. And it divides that from the ciliary zone. And ciliary is for ciliary body, so it's closer to the ciliary body. Here's what the collarette looks like. You can notice that right about this area here, and I won't draw this all the way around so you can look at the rest of that and see it. But if you follow that circle around, you'll see that ridge, and that's the collarette. It's very common that these two zones, the pupillary zone and the ciliary zone, can actually differ in color. And you can see that here. The pupillary zone is a little bit more of a grayish color than the ciliary zone, which is a more bluish color. Another major landmark of the iris is the iris root. The iris root is the peripheral termination of the iris. So in this image we drew here, the edge of the iris is our iris root. That is where the iris joins to the ciliary body. So this is a cross-section of our iris. Let me orient you just a little bit here so we know what we're looking at. The cornea is going to be at the top of our image. This is the iris. Our ciliary body is over here, and our lens would be down at the more bottom part of the image. The pupil will be here where the iris ends. And the most peripheral part, where the iris joins the ciliary body, that's our iris root. And just so to point out, because we talked about that last, you can also note that the collarette is also visible on this image. The iris root is actually the thinnest portion of the iris, as you can see in this image here. So it's only a 0.5 millimeter thick, which is the thinnest portion of the iris. Now you might ask yourself, why is that important that we know that the iris root is the thinnest portion of the iris? Well, we have a clinical condition called iridodialysis. That's where the iris tears away from the ciliary body. It often happens with blunt trauma, so maybe a fist in the eye, or maybe a car accident hitting your head on something very hard can cause the iris to tear away from the ciliary body. I'll show you these are two different patients who have experienced iridodialysis. The top one had a more recent iridodialysis, but I think you can appreciate that the iris root is ripped away. Now, this also has blood between the cornea and the iris within the anterior chamber, and that's called a hyphema if there's blood in the anterior chamber. They had hit their head on a table. Now that one's fairly acute. This patient also had blunt trauma, and you can see it's a smaller area here where the iris is ripped away, this black area here, where the iris is torn away from the ciliary body. Another landmark that's pretty important of the iris is the pupil. The pupil regulates the light going to the retina. The size of the pupil depends on the lighting. The pupil may be anywhere from 1 millimeter to 9 millimeters in diameter. You'll hear the term miotic or miosis. Miotic means the pupil is constricted. And that tends to occur in bright illumination. The term mydriatic or mydriasis, it means that the pupil is dilated. And that tends to occur in dim illumination. Okay, so a miotic pupil, and I'll just write down the other term just so you know it, or miosis, small pupil, mydriatic pupil, or mydriasis. And you'll hear both of those terms very frequently, so you should be familiar with those. So those are some of the kind of big picture findings of the iris. We're going to step back now and talk about the microscopic tissue of the iris, so the histology. There's 4 layers of the iris, and we'll go through those starting from anterior and moving posterior. The first layer of the iris, most anterior, is called the anterior border layer. This is the surface layer, the most anterior portion of the iris, and it's made up of fibroblasts and melanocytes. Both the fibroblasts and the melanocytes are very highly branching. And the density or arrangement of fibroblasts and melanocytes in the anterior border layer contribute to the color of the iris. So a less dense anterior border layer is present in blue eyes, compared to brown eyes where the anterior border layer is more dense. So you can see the anterior border layer on this top image that we've already looked at. It's a very thin layer denoted by F here. So this just very thin layer right at the very anterior surface of our iris, that's our anterior border layer. This bottom image, similar to the top one, the anterior portion is most superior. It's at the top of our drawing. So again, our cornea would be at the top and the lens would be down at the bottom. So our anterior border layer is shown here. The fibroblasts are most anterior, and you can see that branching pattern. Here's a fibroblast cell, and you can see all the branches coming off of that. And then if we strip away the fibroblast layer, then more, just a tiny bit more posterior to that, you will find the melanocytes, and they are also highly branching. The next layer histologically, as we continue to move posteriorly in the iris, is the stroma and the sphincter muscle. Now, there are a lot of types of cells in the stroma, both pigmented and non-pigmented cells. Some of the pigmented cells are melanocytes and clump cells. Some of the non-pigmented cells are fibroblasts, lymphocytes, macrophages, and mast cells. There are also a lot of collagen fibrils within the iris, and these are arranged in radial columns called trabeculae. You can actually see those clinically. They're easier to see in the lighter eyes. You can see these radial striations throughout the blue iris. Very difficult to see. Maybe a few of them you can see in the brown iris, but they're much more difficult to see in the dark iris. It appears more smooth than the lighter irides. But those are the collagen fibers of the iris. In addition to collagen fibers, you will also find blood vessels within the stroma. There are some pretty important blood vessels to know about. So most of the blood vessels in the iris branch off of the major circle of the iris, which is actually in the ciliary body. So if we draw the iris again, looking straight at the person, so here's the iris root, here's our pupil. The major circle of the iris is located in the ciliary body. So we're going to draw it just outside of our iris root. Okay, that's our major circle of the iris. From the major circle of the iris, we have radial blood vessels coursing from the iris root to the pupil margin. So these are going to be coming in this direction. Okay, these are our radial blood vessels. And then finally, we have a minor circle of the iris. This is an incomplete circular vessel that is in the area of the collarette. So you might have a minor circle of the iris here and maybe one here, but it's not a complete circle like the major circle of the iris. One of the things that is quite important about the iris blood vessels is that the vessels are not fenestrated, meaning they're not leaky. They actually form part of the blood aqueous barrier. The blood aqueous barrier, it's similar to a blood-brain barrier where we need to keep some of the stuff we don't want in there, proteins and such and cells. We want to keep those out. So these fenestrated blood vessels of the iris help to keep what we don't want in the aqueous out of the aqueous. This image also shows the blood vessels of the iris. Let's switch colors just because it might be easier to see since these are red. So here is our major circle of the iris. Then you can see the radial blood vessels and the discontinuous minor circle of the iris. Now, occasionally, if you actually look at the anterior chamber angle, the area where the iris meets the ciliary body, you can actually see the major circle of the iris, or at least parts of that. And that's what this blood vessel is showing here, is part of the major circle of the iris. Another very important structure that is found within the stroma is the sphincter muscle. The sphincter muscle is smooth muscle. It's innervated by the parasympathetic system. The fibers of the sphincter muscle encircle the pupil circumferentially. So again, if we are looking at the iris straight on, and here's the pupil, our sphincter is going to have fibers that circle the pupil. Generally, the sphincter is about 0.75 to 1 millimeter wide. And you should be able to figure out what zone of the iris the sphincter is located in, either the pupillary or the ciliary zone. I want you to also picture what happens if this round muscle contracts. That round muscle is going to get smaller if the muscle contracts, and therefore the pupil will get smaller. So contraction of the sphincter muscle will cause miosis. This is a histological image of the iris. And again, just to orient you, the cornea would be up here. This is the lens here. So you can see the anterior border layer. This is actually in a monkey. So they have a very thick, relatively thick, thicker than human, anterior border layer. Then we have the stroma. And within the stroma, you can see the melanocytes and you can see the fibroblasts, you can see some blood vessels, but fairly prominently, you can see the sphincter muscle. This is generally where our clump cells are found. They're generally found in the area of the sphincter muscle. And that's these really large cells that you see here. Those are clump cells. Just aggregates of melanocytes that are clumped together. Continuing posteriorly, the next structure we are going to come to is the anterior epithelium and the dilator iris muscle. Now, there's actually two layers of epithelium that are posterior to the stroma, and they're actually connected. The anterior iris epithelium wraps around to the posterior iris epithelium, but they're next to each other. The layer of epithelium that's nearest to the stroma, so the stroma would be here, is the anterior iris epithelium. And then the layer behind that is appropriately called the posterior iris epithelium. The anterior epithelium is actually a myoepithelial cell. Meaning that there's epithelium, but there's also muscle. Okay, myo is muscle. And that refers to the dilator muscle. Closer to the pupillary zone, there is pigmented cuboidal cells. So let's look back up to this, and we saw the sphincter, where our sphincter muscle is here. And then closer to that sphincter, we are going to have some just epithelial cells. Then about midway through the sphincter zone, then we start to get the iris dilator coming into play. And that's going to go out radially. So it starts about halfway through the sphincter. So most of our dilator muscle is going to be in the ciliary zone. And this again is going to be smooth muscle, similar to the sphincter. The dilator is smooth muscle. So it extends from the iris root to the midpoint of the sphincter muscle. The dilator muscle fibers are arranged radially. So therefore, contraction is going to pull the pupil edges toward the iris root. And that's going to cause the pupil to dilate. So you're going to get a mydriatic pupil. The dilator muscle is innervated by the sympathetic nervous system. So this image shows the anterior iris epithelium and the dilator muscle. So first, we'll point out the sphincter muscle, and that should be fairly distinctive in appearance. There's our sphincter muscle. And then about halfway through that sphincter muscle, you start to get these pink extensions here that connect up. That's the dilator muscle. You can see though that pink area is no longer present here. We only have epithelium at that point, but here we have both epithelium and the dilator muscle. The epithelium is this more pigmented part, and the dilator muscle is that light pink color. This image also shows the layers of the iris. So we can start again at the very anterior portion just to remind ourselves what of all of the layers we've learned about so far. And first we have the anterior border layer. Posterior to the anterior border layer, we have some stroma. And as part of that, we have some blood vessels. So you can see all of the radial blood vessels that are going through the stroma. We have the sphincter muscle. And then as we continue posteriorly, you can see some of the dilator muscle coming in till about halfway through the sphincter. After about halfway through the sphincter, then it turns more into just the epithelial cells, which continue to the end of the iris there. Since we're going to talk about this now, we continue even more posteriorly, and that's where we're going to come to the posterior iris epithelium. And that's these cells here, most posterior. It's very pigmented, and it continues all the way to the end, and it actually wraps around to the anterior iris, and you can actually see this clinically. That area where it wraps around and you can see this is called the pupillary ruff. So I'll show you what that looks like clinically. It's always a brown color. It's easier to see in lighter irises only because of the contrast against the lighter iris. But you can see here, let me change colors here. You can see here this thin brown tissue here. That is the pupillary ruff. You can see it a little bit. You might have to use a little bit of imagination on these darker irises. On the medium colored iris, you can see it fairly well. But it's always present. It's just harder to see in some patients. Okay, so we kind of got to the posterior epithelium. That is the second layer of epithelium of the iris. It's a single layer, very heavily pigmented columnar cells. And we talked about the pupillary ruff. That's the posterior epithelial cells that curl around to the anterior surface of the pupillary margin. Now, a couple of things that we need to talk about clinically in terms of how this anatomy applies to a clinical situation. One of those is an iris synechia. An iris synechia is an abnormal attachment between the iris and either the lens posterior or the cornea and the anterior chamber angle anteriorly. It commonly occurs due to inflammation. The inflammatory cells make the surfaces sticky, and then that causes synechia. So in these images, you can see some cases of posterior synechiae where the posterior iris is stuck onto the lens. Here, the iris is still stuck onto the lens. In this case, it was stuck onto the lens and came apart, and you can still see the pigment from the posterior iris on the anterior surface of the lens. Another clinical situation that is important when discussing the posterior iris epithelium is pigment dispersion syndrome. Pigment dispersion syndrome is pigment that comes off the posterior iris and it's dispersed into the anterior chamber. What happens is that the posterior iris bows posteriorly, and then the posterior iris rubs on the zonules, and those zonules rub off pigment. And you can see that area if you look with what's called a red reflex off the fundus. So this is kind of like the red reflex that you see when you take a picture. You'll see a red reflex in the pupil. You shouldn't see red in the iris because the iris is very thick and because it has a very thick posterior border layer. But in this case, right around the edge here, you can see that there's areas of red reflecting off the back of the eye. And that tells us that there's not as much pigment on the posterior iris as there should be. That pigment gets into the aqueous and will deposit on the posterior portion of the cornea. So this is our cornea, and it really should appear nice and clear here, but you can see little specks of pigment there, and that's on the posterior area of the cornea in a patient with pigmentary dispersion syndrome. Iridodenesis is a trembling of the iris. I remember iridodenesis because my name is Denise and I tremble with fear when I lecture in front of people. So a trembling of the iris, iridodenesis. Normally, the posterior iris sits on the anterior lens. With iridodenesis, the lens is no longer behind the iris. This may be because of complications in cataract surgery. It may be due to trauma where something hit the eye and the natural lens was displaced. Either way, there's nothing there to support the iris, and therefore you see this trembling of the iris. So kind of an interesting condition. Okay, so let's make sure we wrote down everything we want to here. So we talked about iris synechiae, which is a stickiness of the iris and the lens. We talked about pigment dispersion syndrome, where there's pigment being rubbed off the posterior iris and deposits in the anterior chamber. And we talked about iridodenesis, which is the trembling of the iris because the iris is no longer supported by the anterior lens. All right, let's talk now about a few more characteristics of the iris. One of the things you'll commonly see on the iris is called crypts of Fuchs. These are depressions or openings on the surface of the iris. They are found near the collarette. They can be seen more peripherally too, but then they're not called crypts of Fuchs. They're just called peripheral crypts. They don't get a special name. So crypts are something that you will see on most eyes. So once you start doing slit lamp, definitely start looking for these. Here you can see the crypts, these depressions in the iris. You can see them here as well in the area of right around the collarette. Another thing you might see on the iris are called circular contraction folds. These are found in the ciliary zone. And they occur due to contraction of the tissue when it moves towards the iris root during dilation of the pupil. So you can see these circular contraction folds here. And they're also shown in this top image here. In the peripheral area, the iris dilates and the pupil dilates and the iris starts to wrinkle. The iris color is dependent on a few factors. First of all, it does depend on the number of melanocytes, although they have shown that while it does affect the color, that the number of melanocytes is actually fairly constant between different iris colors and different races. The type and density of the melanin granules within the melanocytes in the anterior border layer and the stroma will affect the color, as well as the density of the anterior border layer and the stroma. The combination of those two things affects how much light is absorbed and how much light is reflected, and therefore that makes up the color of the iris. You'll very commonly see iris nevi, or an iris nevus is a singular of iris nevi. This is a hyperpigmentation of the iris, basically a freckle on the iris. This is an accumulation of melanocytes. In the anterior border layer specifically. You'll also hear the term heterochromia. Heterochromia is a difference in color between the two eyes or within an iris. So let's take a look at that. So this top image shows a fairly large iris nevus. And the bottom image shows heterochromia, a difference in color between the two eyes. Most of the time, this is congenital, but it can indicate a disease process. Inflammation of the uveal tissue can cause heterochromia. Also, a disruption in the sympathetic innervation of the iris can cause a difference in eye color. Okay, I think this is a good place to stop for now, and we will start next time by talking about the ciliary body.